Good morning. It's 12 past 8 at News Radio 710 Keel. Robert J. Wright and Erin McCarty, and in studio is State Senator John Milkovich.
Good to see you, Robert.
Good to see you, Mr. John. There's biomedical research, and there's university health, and there's the medical school, and good Lord, man, what a tangled web we've woven.
We can simplify.
I hope so.
There seem to be two sides of that coin. There's the one side that says that biomedical research has been purposely lowballed by the state, that they want biomedical research out. They want either another nonprofit in, or in fact, there are South Louisiana power brokers, politicians who want our medical school for Baton Rouge. Then there's others that think biomedical research is a bunch of inept boobs who couldn't handle 25 cents.
Wrong answer.
25 cents, much less $25 million.
Actually, biomed was started over 30 years ago by Virginia, I believe over 30 years ago, by Virginia Sheehy and others. And basically they said, Shreveport's an oil economy. What can we do to diversify our economic base? The people that are in this, BRF's done a great job with our hospital, and I think they deserve our support. This is the reality. Over the last 3 years, since Governor Jindal made the decision to privatize, BRF, University Health, has pumped over $380 million into the med school and into the state coffers.
Was privatization by Governor Jindal, was it a good idea, a bad idea, or, as some will say, a good idea poorly implemented?
I think with respect to University Health, formerly known as LSU Hospital, Confederate Hospital before that, privatization has worked, and it's worked well. I believe the hospital is operating, doing a great job. Not only have they pumped over $380 million into the state government and the medical school, they've invested $50 million of their own money into capital improvements at the hospital. When they've also, according to the state, saved the state over $100 million. Folks, our hometown, LSU Hospital, University Health, Confederate, BRF, the home folks, what we've done is we've saved the state over $100 million. We saved the state more than any other charity hospital in the state of Louisiana. And really, what are we asking? And this is a community effort. Biomed is a community organization. They weren't founded to make money. What are we asking? A fair shake. Allow us to do what we want to do.
So you think the state, you think John Bell and others in Baton Rouge are purposely lowballing Biomed?
I am not here to criticize the governor. You know, he's a family man. He goes to church. I want to see the governor win. When the governor wins, the state wins. I'm just saying we're reaching out to the governor and asking him to work more closely with Biomed and University Health and understand if someone's doing a good job, if someone's doing what they said they were going to do, if someone's conducting 500,000 patient visits a year, when someone goes in and takes over the hospital and reduces the waiting time from over 12,000 patients waiting to get an appointment to a working functional level, then how about a fair shake?
Do you agree or disagree that there is I'll choose a word poorly, a coven of South Louisiana politicians who want our med school moved?
There may well be, but we need to make a stand and stand up for our hospital and for our medical school and understand that, as Representative Sam Jenkins says, our med school and our hospital are like bacon and eggs. They go together. But I believe, and I've had the opportunity to research this. I've sat in with meetings in the governor's office, sat in with meetings with legislators, sat in meetings with LSU, sat in with meetings with the BRF people. They're doing a great job. They're not in it for the money. They've increased the quality of health care. They've reduced waiting times. This is what has happened.
Well, pardon me then. Pardon my French. What have they done to piss off so many people?
Well, I mean, some people say that there are political power plays going on behind the curtain, behind the scenes.
That's what I want to ask you about. That there's another player at the table. Senator Greg Tarver told us as much, that they could be ready in a day. Who is that? How much do you know? How much can you tell us?
I don't know who the power. There's people saying who they think the power player is.
We've heard Oshner. We've heard Children's. Folks have said Willis Knighton.
People have said those things. I hate to publicly state something that I don't know. This is what we're saying. Robert and Erin. If someone has done what they said they were going to do, if someone's doing a good job, if someone's fighting for the community, and by the way, these folks aren't in it for the money. John George worked for University Health 14 months without pay. Steve Scrivanos worked for University Health over 3 years without pay. It's a volunteer board. These people aren't in it for the money. They love our community. And if someone loves Shreveport, by the way, they're believers, they're Christians, they're fighting for the people, they're making the hospital better, they're doing what they said they were going to do.
So why do we have the problem?
Great question. How about we give them a fair shake? And what about this? You know, in New Orleans, a brand new hospital was built that cost $1.6 billion. And we're saying, look, all we ask from the state is a fair shake so we can keep our pipes fixed and keep serving the people. And this is also important for the community to know. You know, we think historically of LSU, University Health, Confederate. This is a health resource for the medically underserved. It is also the level 1 trauma center in this part of the United States. Folks, we want University Health to stay there. If you or your family member gets in a bad car wreck, motorcycle wreck,
That's where I want to go.
heaven forbid, a shooting,
Can
you're going to University Health.
Can you stay with us? Because I want to talk to you about that 45-day window, what's being done, and how serious it is.
And what is being done in Baton Rouge legislatively by people like you to try to find a solution.
Thank you.
News Radio 710 Keel. Okay, so much to say and so little time. News Radio 710 Keel, Robert and Erin, and State Senator John Milkovich is here. And we're talking University Health and the med school and biomedical research and the deal that's trying to get done. And if there's a button on the table and Mr. John can push the button, a deal with the med school and the state and biomedical research gets done in this 45-day window, would you push the button?
Well, I'll say this. We have a deal. Why don't we abide by the original contract? If BRF is doing a great job, and they are, by the way, we talked about the level 1 trauma center. Also, if you have a stroke in this part of the United States, you go to University Health. They have an accredited stroke program, the best in this part of the United States. They've recently been accredited by the Joint Commission on accreditation of hospitals. They have a new medical decisional support software. They've reduced the patient waiting list from 12,000 to a normal number of 12,000. They've introduced patient care metrics. They've got a clean bill of health on at least 2 third-party independent outside.
If they're so awesome, and now I'm not arguing their awesomeness.
Is there politics in play?
If
Yes.
they're so awesome, why don't politicians in South Louisiana, specifically the Dems currently in power, recognize that?
Who's the snake in the grass is what we want to know.
I may not be the person to answer that question. What I can say is that our North Louisiana delegation and the people of North Louisiana need to not criticize anyone, but to reach out to our governor and say, Governor, we thank you for fighting for flood victims. We thank you for going to Washington and speaking out for the Louisiana people that have been hammered. This is another area where we need to work more closely with the governor and communicate to him, these folks are doing a good job. They're not in it for the money. They love the community.
But do people need to understand that there is a faction, a group of lawmakers in South Louisiana, specifically in Baton Rouge, who don't want the deal to get done?
There is resistance to biomed. There is political resistance. I believe it's politically motivated. It's difficult for me to say who all is behind the curtain because honestly, I don't know all the.
They don't let us behind the curtain.
Is there a South Louisiana group that would be against any deal with biomedical research or any area or any nonprofit simply because they don't want that med school here, they want it down there?
I believe that there are people in the state that would like to see our medical school moved out of Shreveport. But the fact of the matter is, North Louisiana is often last on the list when it comes to state money, state revenue, state resources. And the people of North Louisiana say, look, we're not asking for special treatment. We want a fair shake for our hospital and our medical school.
Let me ask you this. What is going to happen over the next 45 days? who is going to be at the table? Do you have a place at the table, or are you going to have to kick somebody out of the way?
Well, I'm simply speaking out on behalf of the people of North Louisiana. The principals obviously are the biomed folks that are running the hospital and the governor's office. And the question, that I have, and in fact, a prominent Shreveport attorney said it Monday in court when I ran into him. He says, "Why can't we go by the original deal? There's a contract in place. We've worked hard. We've tried to do our part." The state does owe University Health millions of dollars of back money that we need to continue to run our hospital, keep it strong. I would love to see the Louisiana state government say, look, you guys are doing a good job. You're in it for the right reasons. Your heart's in it. You're doing the right thing the right way for the right reason. Why don't we just honor the contract that we have and say, God bless you? That's not power politics. That's good government.
But, Mr. John, in the end, is it going to come down to power politics? The North, who wants people up here who want the deal done, and people in the South who don't. Is it really going to be a tug-o-war?
It's a tug-of-war. It's a fight. It's a war. They're trying to take University Health out. But this is what we can do. We can fight.
So you just finally said it.
We can fight.
They want to take University Health out.
I believe there are people that, yes, I believe there are. I do believe that. And I think what we can do is we can fight, we can speak out, we can pray, we can work. We can let the people know what's going on. People, stand up for your hospital, stand up for your medical school. They do go together like bacon and eggs, to quote Representative Jenkins. And by the way, University Health employs over 3,000 people in this community. So it's not only is it rendering high level of medical care, not only is it reduced patient waiting lists, not only has the quality of care improved under privatization, that's an economic engine for Northwest Louisiana.
But one of the most powerful senators around is Senator Greg Tarver, who doesn't want this deal. He's a local guy. He would like to put LSU Med and University Health back together like it used to run. We have one of our own local guys fighting this deal. Does that trouble you a lot?
Well, Senator Tarver is a veteran, seasoned, knowledgeable senator. It is accurate to say that Senator John Milkovich on this issue has a different perspective from Senator Tarver. And by the way, we were mentioning it off camera, as you say, off radio, off air, that he and his wife do wonderful work in Africa, Christian mission. So we appreciate his contributions. It's fair to say that I have a different perspective.
But if I'm the governor, I'm going to look at you guys and go, your own delegation can't come to the same conclusion on this. So what do you expect me to do for you?
Answer hers and answer mine. It'll be the last question. How do you get a deal done when so many people don't want the deal to get done?
I believe that I would love to see us abide by the original contract because University Health is fighting hard for our community. And the way we fight is with facts, with hard work, with speaking out. And we're believers up here in Northwest Louisiana. We know how to pray.